In this video, I wanted to share some thoughts that were very useful for family and friends that were visiting me in the hospital. Obviously, it's a very stressful time, and there's a bit of a learning curve, particularly if you're not familiar with medicine, surgery, critical care, ICU, or any of those things. The point is not to be intimidated, but just simply to ask. The nurses are there to help you. There's plenty of staff. There are patient advocates, there are care assistants, nursing assistants. They're all there to help you, to answer your questions, to make sure that not only are you comfortable, but that the patient is comfortable and well cared for. Ask for a tour of the ICU or the floor. This is a common practice in many institutions. Become familiar with where the comfort items are. There are usually a kitchen or a patient comfort station, or however it's labeled or termed in the particular facility you're at, but there's bread, there's toast, there's juices, jams and jellies, a variety of things that just make the day go a little faster, hot water for tea, just things that will add a little bit of comfort not only to the patient's day but also to your day. The days are very long, sitting in a chair in the corner of the room, being stressed out about your loved one's recovery. I totally get that, but understand that there are a variety of things that will make it much better for you. Also explore and ask about family areas or quiet areas. There may be meditation rooms, there could be little nooks and crannies that are set aside for family members to sit in quiet just to get away from the noise of the ICU or the stress of the particular situation. It's important to recharge, regroup, and to care for yourself as well. Familiarity obviously breeds comfort, and just knowing about the process, knowing what to expect, knowing when to expect it, goes a long way to easing anxiety. Ask the nurses when the team will be rounding. If you want to know what's going on with your family member or friend or loved one, being present when the surgical team rounds is key, just to ask questions, to see what the plan is, and to just get an overall overview of what's going to happen that day and the next few days. Getting to know the other staff is also very beneficial. There'll be a variety of people in and out of the room at various times. Usually the mornings, if you're in a teaching institute, there'll be a resident or fellow that comes by before any other physician. There's nurse practitioners and physician assistants who are also involved in care. They're usually there during the day-to-day management and nights to handle problems and put out fires, whether it's an issue with the chest tube, a concern about a rash or some itching or some other issue. Usually those are addressed by the resident, the fellow, or the mid-level providers such as nurse practitioner or PAs, as opposed to the attending surgeon being woken up in the middle of the night for a Tylenol order. And understand that you do have some say. If there's something that's happening or perhaps someone who you're not comfortable with, you can certainly voice that opinion. There are hierarchy of administrative levels in the hospital, just like there is in a business. There are nursing supervisors and care supervisors. And so a prime example is of my hospitalization was there were several nursing students, and they were most all excellent except for one was really unsure of himself, didn't wash his hands, and attempted to flush my IV with dirty hands after dropping a syringe on the floor. And we just said, no, this isn't going to happen. I'm sorry. And he understood and left, and that was that. But you do have say in your care. The smells obviously are different. Hospitals have peculiar smells, and it can be unsettling for a number of people. Things that can help are aromatherapy. I talked about this in other modules as a beneficial way to treat nausea and to facilitate comfort for the patient, but certainly also helpful for visitors and family members and friends who are sort of immersed in this environment for generally about a week of their lives. Different smells trigger different emotions, so you're likely going to have to experiment, whether it's eucalyptus or lavender or ginger. It totally depends on your nose. Remember to help the helpers. The staff are there to help the patient and to make sure that everybody's comfortable and getting the proper care, but understand that they are busy and at times they're tied up. Maybe a patient's doing poorly or a patient needs to leave the floor for a test or a procedure, and they're not there to answer your immediate needs, and you can certainly help them as a family member or friend. You can fill water, you can get snacks, you can ask where the blanket warmer is. This was a huge benefit during my hospitalization because I couldn't regulate my temperature and I was always freezing cold. Knowing where extra washcloths are, towels, and gowns is also very helpful. Understand that there are a variety of things that can be done as a family member and friend to not only help the patient but also help the helpers.